Thank you. This video is designed for people helping us with the Porridge study and really to help you understand what we're trying to achieve. Porridge stands for Perceptions of Relative and Real Importance of Different Gynecologists' Expertise. What we're trying to do is to try and work out what makes an expert gynecological surgeon, and in particular to look at trainees and consultants' perceptions of a relative importance of different qualities. Assessment of gynecologists' surgical competencies is a priority. A well-established, comprehensive and widely adopted model for competencies exists in the Canadian Royal College CanMed's framework. However, little is known about gynecological surgeons' perceptions of the CanMed's competencies and how they differ between training young specialists and older gynecologists. So this study is a questionnaire study. The questionnaire only takes a few minutes to complete, but it can't be completed unless you really understand what the questions are about. So CanMeds is looking at 7 different key competencies to make a trained gynecological surgeon in this case. The first is a medical expert, the second is a communicator, the third is a collaborator, the fourth is a manager, the fifth is a health advocate, the sixth is a scholar, and the seventh is a professional. So just to explain exactly what these 7 key criteria involve, I'm going to go through them one by one, starting with a medical expert. So a medical expert for a trained gynecological surgeon should be someone who is able to function effectively as a consultant, integrating all of the other CanMeds roles to provide optimal, ethical and patient-centered medical care. They should be able to establish, maintain clinical knowledge, skills, and in this case gynecological surgical skills, and attitudes appropriate to their practice. They need to perform a complete and appropriate assessment of a patient. They need to be able to use preventative and therapeutic interventions effectively, and in this case for a gynecological surgeon, and to demonstrate proficient and appropriate use of procedural skills, both diagnostic and therapeutic. And of course they need to seek appropriate consultation from other health professionals, recognising the limits of their expertise. And that is what makes a medical expert. Those are the key competencies. Now there are certain other competencies that can help and assist with that, and that is in the CanMeds document, which is attached as a PDF in addition to this video, and someone can eyeball those just to get an idea of what these 7 competencies are. And in the questionnaire for this competency and for others, we'll be asking trainees and trained surgeons to judge how important they feel this is as a competency for a trained gynecological surgeon, from a level of 1, not very important at all, to 5, extremely important. And what we'll be asking them is whether or not they think they have achieved this goal, either as a trained gynecological surgeon or as a trainee, whether they think they have reached this goal, yes or no. The second key role is being a communicator. And a trained gynecological surgeon should be able to develop a rapport, trust and ethical therapeutic relationship with patients and families, accurately elicit and synthesize relevant information and perspectives of patients and families, colleagues and other professionals, accurately convey relevant information and explanations to patients and families, colleagues and other professionals, develop a common understanding on issues, problems and plans of patients and families, colleagues and other professionals, develop a shared plan of care, and convey effective oral and written information about a medical encounter. And other competencies that are required in order to achieve these key competencies to become a communicator are again detailed in the CanMeds document, which is attached as a PDF, and examples are there, and these can be eyeballed if you want further information. And again, you'll be asked to grade these from 1 to 5, not important at all, to extremely important, and whether or not, either as a trained gynecological surgeon or as a gynecological surgeon in training, the individual feels that he has achieved this goal, either yes or no. The third one is a collaborator, and a trained gynecological surgeon should be able to participate effectively and appropriately in an interprofessional healthcare team, effectively work with other health professionals to prevent, negotiate and resolve interprofessional conflict, and again will be asked to grade these from 1 to 5 and whether or not they have achieved them, yes or no, wherever they are in their training. Again, further explanation on this key competency can be seen in the CanMeds PDF. Manager is another key competency, and a trained gynecological surgeon should be able to participate in activities that contribute to the effectiveness of their healthcare organisations and systems, manage their practice and care effectively, allocate finite healthcare resources appropriately, and serve in administration and leadership roles as appropriate. And again, we'll be asking people to rate this competency and importance from 1 to 5 and whether or not they feel they have achieved this goal, yes or no. Health advocacy is the fifth competency, and a trained gynecological surgeon should be able to respond to individual patient health needs and issues as part of patient care, respond to the health needs of the communities that they serve, and identify the determinants of health of a population that they serve, promoting the health of individual patients and communities and populations. And again, we want people to rate the importance of this from 1 to 5, not important at all, to extremely important, and whether or not they've achieved this role, yes or no. Scholar is the sixth key competency, and a trained gynecological surgeon should be able to maintain and enhance professional activities through ongoing learning, to critically evaluate information and its sources and apply this appropriately to practice decisions, and to facilitate the learning of patients, families, students, residents, other health professionals, the public and others as appropriate. And as well as this, they need to contribute to the creation, dissemination, application and translation of new medical knowledge and practices. And we want to rate the importance of this from 1 to 5 and whether or not they've achieved this goal, yes or no. The final health competency is professional, and a trained gynecological surgeon should be able to demonstrate a commitment to their patient, profession and society through ethical practice, to demonstrate a commitment to their patient, profession and society through participation in profession-led regulation, to demonstrate a commitment to physician health and sustainable practice. And again, we're going to ask everyone to rate this in importance from 1 to 5 and to say whether or not they have achieved this goal, yes or no. So we'll be collecting some other information. We'll be collecting information about demographics, what position people are in, whether they are ST1, 2 or a consultant. We'll be looking at sex differences. We want to look at age as well. And because it's important that we have a wide spread of trainees and trained gynecological surgeons, we're going to ask people that if you agree to participate, we will ask you to get one other person to participate in the study as well. Now, if you're a trainee, we will ask you to invite a consultant who has not already agreed to participate in the study, and if you're a consultant, we'll ask you to invite a trainee who has not already agreed to participate in the study. And the outcomes, we want to look at the differences in perceived importance among doctors of different grades, sex and age, and whether or not differences exist in those who perceive themselves as trained in a specific area. So that's the aim of this study. There is a Survey Monkey questionnaire which takes about 2 minutes to complete. And if you're watching this video considering to participate in the study, we're extremely grateful for your assistance. And you can download the PDF file of the CanMeds competencies, which would be attached with the email which you received this video. Many thanks.